Hello everyone, and welcome to Draw Their Life. This is Roberta. She is 40 years old, has a teenage son, and has been married to her husband for some time. Roberta is a very happy woman, and like any other person, she has family problems, kid problems, stresses, etc. However, she does have a particular kind of a personal problem. Roberta has what doctors call secondary anorgasmia. She has difficulty in attaining orgasm, whether by intercourse or masturbation. This is typically not affected by her arousal or desire, but over time, that definitely hinders. There are two types of anorgasmia: primary anorgasmia and secondary anorgasmia. Primary anorgasmia is when women have never experienced orgasm, while secondary anorgasmia is used to describe women who once experienced orgasm but have lost the ability. Roberta has begun to feel enormous frustration over the success of orgasm during intercourse with her husband, especially when he tells her, "Just let yourself go." Yeah. This is when all hell breaks loose. Not only has Roberta lost her arousal, but she is now in an uncomfortable situation as she will begin to fake her orgasm. What Roberta fails to realize is that by doing so, she is making it difficult to seek help. Therapists say that female anorgasmia is the second most common sexual function difficulty. However, with some relationship work and behavioral assignments at home, which will increase sensitivity, anorgasmia can be a thing in the past. So, Roberta, hang in there. Primary and secondary anorgasmia does not only occur in women, but it is also common in men. And it is also caused by medical problems and psychological issues such as drug addiction, alcoholism, depression, grief, or loss. Meet Joe. Joe is 37 years old and is currently taking Prozac, an antidepressant for, his depression. It is estimated that 1/4 of users of antidepressants are affected by anorgasmia. Do not worry though, as Joe and his husband Glenn are seeking psychologic and physiological sexual approaches to resolve his orgasmic disorder. Now say hello to Esteban. Esteban is 28 years old and has recently proposed to his girlfriend Padma. The couple are excited to share their lives and start a family. However, there is a tiny problem. Esteban suffers from retrograde ejaculation. This orgasmic disorder does not affect Esteban's ability to have an erection or have an orgasm. But when Esteban reaches his climax, semen goes into his bladder instead of coming out via the penis. I know this sounds concerning, but retrograde ejaculation is not harmful. Signs of retrograde ejaculation include orgasms in which very little to no semen come out via the penis, urine that is cloudy after orgasm because it contains semen, and the inability to father a child. Let me show you how it happens. During a male orgasm, a tube called the vas deferens transports sperm to the prostate where they mix with other fluids to produce liquid semen. The muscle at the opening of the bladder, or the bladder neck muscle, tightens to prevent ejaculate from entering the bladder as it passes from the prostate into the tube inside the urethra. With retrograde ejaculation, the bladder neck muscle does not tighten properly. As a result, sperm enters the bladder instead of being ejected out of the body via the penis. Although this is an odd predicament for Esteban, he and Padma are not worried, as when the time comes, they will know to seek treatment to get pregnant. As for now, they are anxiously awaiting their wedding day. Last but not least, meet Han. He just turned 21 and has enjoyed his first few legal drinks. Han is your typical funny, charming, smart, and outgoing guy. Ladies, Han would make a good catch, but he doesn't date much. Why? 2 words: premature ejaculation. Premature ejaculation occurs when a man ejaculates always or nearly always within 1 minute of penetration. Men are unable to delay ejaculation during intercourse or masturbation all or nearly all of the time. Some psychological factors that may play a role include, but are not limited to, sexual abuse, poor body image, and depression. Because of his disorder, Han feels distressed, frustrated, and avoids sexual intimacy as a result. What Han fails to know is that premature ejaculation is common and is treatable. However, men feel embarrassed and simply avoid seeking help. Medications, counseling, and sexual techniques are available to help improve sexual life. So, dearest Han, do not worry, as help is available. So this marks the end to Draw Their Life. On behalf of myself, Roberta, Joe, Esteban, and Han, we all thank you for your time. Remember, disorders do not define who you are. You are all wonderful people. Adios.